say too, data-driven marketing, the data analytics, just enabling us as marketers, to gain insights into our target audiences, like their preferences and their behavior, and then how to tailor our message from that content creation strategy that you and I were talking about. And then one other trend I would say would be value-based marketing.
As healthcare marketers, we know three things to be true. Helping people is why we do this job. What's expected of us can get overwhelming, and there's power in community. Join us each week for stories of marketing struggle and success as we build the community to answer that question. What is the move in healthcare marketing?
At the core of healthcare marketing, we understand that there is someone who will be positively impacted by our service or product. I've seen firsthand how marketers in both B2B and B2C healthcare spaces can make a positive impact on society's well-being. But there are nuances to both B2B and B2C healthcare strategies. Hello, I'm Larry Williams with Unlock Health. Today I chatted with Julie Plummer of Onsite Women's Health, and we discussed the transition she made from B2C with a large hospital system to Onsite Women's Health, which markets to physician practices, shifting her to the B2B space. In this conversation, we discuss how storytelling is impactful and unique in both B2C as well as B2B. We compare both sales cycles and review how collaboration differs in both roles. Julie also details how marketing has changed throughout her journey and what she's excited about moving forward. I hope you enjoy this conversation. All right. Julie Plummer, welcome to The Move. Thanks for joining us today. We're so thankful that you're willing to share your expertise in this conversation.
Oh, well, thank you for having me, Larry. I mean, I'm really excited to be here today and hopefully provide some valuable insight into the world of marketing. So,
Well, you and I've, been friends for about a year now. And
yeah.
so like when we started these conversations about the podcast, you were definitely first on the list of people I wanted to speak with just because you have so much experience from the B2C side to the
Yes.
B2B side, all within the healthcare space. And so we'll just jump into that conversation. I'd love to know more about, your experience at HCA. And if you're a local Nashvilleian, I guess if that's a right word, we know what HCA is, and we know how large of an organization they are. But
Yes.
I'd love for you to give that 10,000 foot view of where you came from with HCA, and then we'll go from there.
Okay, this is perfect. Well, first things first, let me go ahead and educate you that it is HCA Healthcare,
See,
not HCA.
there we go.
So
Thank you for that.
you're welcome. So that was actually part of my job was to, as part of HCA, went through a brand refresh in 2019, and so we kind of refreshed, you know, HCA Hospital Corporation of America to HCA Healthcare. So if you ever see anybody say HCA that works there and it's not HCA Healthcare, that's a no-no. Yeah,
I
it's
will correct them
HCA
quickly
Healthcare.
because
Yes.
hey, old habits die hard, right?
Old habits die hard. And people, internally, I mean, people still say it. And like I said, I still feel like I work for HCA Healthcare. I mean, you just always kind of have that in your blood. But just to give kind of a high level overview, HCA Healthcare is the leading healthcare provider across the nation. They have 186 hospitals and more than 2,400 sites of care. And then we also have entities or hospitals in the UK. So it is a wonderful organization. I've learned a lot while I was there. I was the marketing PR director at three of their hospitals. One who has a world renowned burn center in Augusta, Georgia. So I learned trial by fire, fresh out of college. Worked at Doctors Hospital, Joseph M. Still Burn Center, and the stories that impacted me there have basically followed me throughout my career. And I've just learned things along the way and continue to grow and evolve. So,
That's great. And you've had such a great experience at HCA Healthcare.
yes,
And when I say that experience, I think about how well-rounded you are in the marketing, sphere. So
yes.
from brand strategy, PR, community manager, content creation, and event marketing, you did it all. And so like just in our conversations, I got to learn more about all the different roles you had.
Yeah.
And that being said, like, how did you navigate those, all those changes over, I think it was a 16-year career with HCA Healthcare?
Yes. Larry, that is such a good question. Again, when I started, fresh out of college, you don't really kind of know what you're going into. You think you know, but you have no idea. And initially, I had a director who hired me, like I said, fresh out of college, and I was a community relations manager. And so I will never forget, I'm stuffing cradle club bags for the local OBGYNs, making sure that we promoted our women and children's service line and getting those community events, like you were saying. However, my director, I was 23 years old. She took a position in Charleston, and I was left being the interim director of marketing and PR and the community relations manager for a 356 bed facility in the Burn Center. So it was a lot to learn. And you're everything. Marketing is a service department. I am making brochures for various service lines: orthopedics, cardiac, burn. You are trying to get the word out there about what the hospital does in the local community. So I've always said marketing pays and PR praise, so when you have kind of that shoestring budget, kind of at that local facility, I try to always maximize my marketing efforts through PR, because, it's almost that third party validation and gave that credibility to the facility. So I always try to optimize both ends of the marketing spectrum, I guess, if you will, because you're everything. And as you grow and evolve, healthcare changes. Healthcare is changing every day, So I remember when social media, I was there at TriStar Summit here in Nashville. I was the marketing PR director there. And it was, oh, hey, all of our hospitals, we need to be on social media. And we're like, what? So then you had to add another layer to your role. And so you had to learn. And, I remember, okay, I have 100 followers. What does this mean? And now today it's like we've got 20,000 followers. And I can say on the corporate HCA Healthcare LinkedIn page, we have over 500,000. So to watch this grow, like the marketing industry, that has grown. And we've actually, and I'm speaking like I still work at HCA Healthcare right now, but we really did grow up. I've always said healthcare marketing has always been about 10 to 20 years behind in my mind. But honestly, like within the past 5 years, they really took it to a new level, to where we were working as a team. And instead of individual silos in hospitals, we all came together to share resources and optimize what we were doing from a dollar spend as well. So it just a lot went on with that brand refresh from 2019 on. And I just feel like we kind of grew up in the marketing world.
Yeah, and like you said, experienced a lot of changes through that. Like, it was
Yes.
trial by fire because our communication changed so much in that time frame as well. I mean, you even mentioned the social media. I'd say that was like the wild west of social media. You didn't know what platforms were going to take, which ones weren't. While you're
Mm,
learning about, okay, what's how to harness this power and how
yeah,
to use this to actually connect with people. And so we didn't really
right.
know how to go about that. We have a much better idea now, but back
Yes.
then, yeah, you were learning as you went, for sure. So,
Yeah.
and one thing I like to kind of talk about, you had a great experience with HCA Healthcare, and
Mhm.
you speak about it with such admiration.
I
What
do. Yeah.
does that like? What caused you to decide to, transition away from HCA Healthcare? Because yeah, it's always hard leaving a place that you love and people who you admire,
Right.
and I know that had to be a tough transition, but I'd like to hear why you made that transition to on-site women's health, and I also like for you to, give that 10,000-foot view of what the services that on-site
Yes.
women's health provides.
Absolutely. Like you were saying, 2019, I transitioned from the hospital world to the corporate side at HCA Healthcare and was part of that brand refresh. I will say something that I think that will be such a good nugget for your audience is that when we would speak to our internal audiences, we would say a brand is not a logo, it's a promise. And
I like
so, what were we doing that we could help deliver on our promise, from an HCA healthcare provider standpoint to our patients? So, I just really connected with that personally. I got to tell those stories, which was huge for me. I got to be the good storyteller. We had I'll say their names, Ed Fishbow and Harlow Summerford. They're two of my favorite people. And Marianne Hodge. I learned so much from them, but they were always a lot of them, the reactive side, to where I feel like I was able to be part of that proactive side. So I was always kind of the good cop, bad cop in a way, but I got to tell the really good stories and highlight our people and celebrate our teams. COVID took a number on us. We were pretty much working around the clock during those times. I mean, we were doing 2 stories a day on social media. And you were talking about what platforms took off and what didn't. Facebook was always pretty much stable. LinkedIn blew up. We were just seeing numbers that we hadn't seen before. Like, I mean, we were like, you know, uh, and Instagram
it.
really took off. We had just started that Instagram account in 2019, and I think now it's got like 15,000 followers. I mean, we really
Wow.
grew that platform as well. Twitter did not take off as much as we thought it would, or X now,
Yes,
formerly known as
yes.
Twitter.
It's gonna be
Uh,
hard to leave that one behind.
yeah, we'll leave that one behind. Yeah, that one flew away. No, but it's still there. But that one didn't perform as well. I mean, obviously it did in some ways, but that was more of that, thought leadership aspect or platform. We just spoke to it a little bit more newsy, bite-sized information. But that transition. So after COVID, everyone's kind of wondering, what do I do? Like, do I want to stay in this role? What is my purpose? And I was also turning 40. You kind of hit that age, and it's like, okay, I've given 18 years of my career life to HCA Healthcare, and I love it. And like I said, I still feel like I work for them today. Um, but I always had some of my colleagues. You network and you develop these friendships with peers that are doing kind of the same thing you're doing, and they're like, Julie, you have to go and try something else. I'm like, why? I'm very happy. I love what I do. I do have a good work life balance. However, this position at Onsite Women's Health, a former HCA Healthcare CEO was the CEO at the time. And they were just like, please, there's this marketing position available. Just have a conversation. I was like, okay, I'm 40. I can have a conversation. I'm a big girl. And so I went and had an initial conversation with him. It went so well. And what Onsite Women's Health does is we encourage convenient access to breast cancer screenings, mammography screenings. And just kind of when Brian and Jillian Wright, who's now our chief executive officer, when you just hear them speak and their passion for what they do on a day-to-day basis, I was like, you know what, this could be a good thing. And so after multiple conversations and interview rounds, I hadn't done that in about, again, 18 years. It just was a really um I don't know, it kind of gave you a different energy. Like, I just felt like
Sure.
I needed to grow in a different way than I was going. Like, I was happy, I was comfortable, but I felt like at 40 I needed to challenge myself and learn something new.
Did going through that process, was it a form of self-discovery? You're asking your questions that you haven't asked yourself before professionally, and that kind of yeah, allowed you to open your eyes to really what you wanted this next phase of your life to look like?
Yes, 100%. And I always like to make decisions. I like to, like, let's make a decision, let's go with it. And, at HCA Healthcare, you're making a decision that could potentially affect 186 hospitals and 2,400 sites of care.
Sure.
There's a lot of players involved, a lot of stakeholders. This opportunity with On-Site Women's Health is completely different. It would be me, myself, and I, kind of like a one-man band again. I'm kind of reverting back to my younger days. Um, but it also came with the position of sitting with leadership, making decisions. And this company, we are going into our 15th year. It was part it gave me a way to be creative and build this brand. Like, I had been part of building that brand at HCA Healthcare. I was able to do this here, and I was
Yeah.
really excited for that opportunity. And I mean, whoo, it's been a busy year so far. So yes,
Yes, I bet. So when you think, oh, so tell me real quick. So HCA Healthcare,
yes,
you're reaching out to consumers. So I think
yes,
about that more on the B2C side.
correct,
Onsite Women's Health, you're actually working with healthcare providers, and so I
correct.
would say it's more like a B2B model. Am I correct in how I'm looking at that?
100%. So, marketing world at HCA Healthcare, yes, B2C side, especially from the hospital level, we're working with consumers. We, at one point, were working with health grades where we had like 32 predictive modeling indexes to kind of track a patient's journey, and we were able to see, if we were able to tell, like, do they buy cigarettes? Do they have a gym membership? You could track these things. So it's like we would send direct mailers going, "Have you seen your heart doctor? Or have you been?" So I'm like, if I ever get one of those flyers, I'm going to the doctor because they're tracking something that I don't know
Just
about,
you need
kind
to
of
be
thing.
aware of it.
I need to be
Yeah.
aware of it. Yeah. So we were trying to educate our consumer audience on the services that they may potentially need down the road. Or, you know what? Hey, we're educating you that we're here in the event you need us. If you have small children, we have a pediatric ER. We're trying to connect with them in an emotional connection. Like we would have the young children falling off their bike and needing to go to the ER, or like doing those. We would do commercials. We would do, you know, different advertisements via social media, things like that. But no, it was very much a individual journey there that we would try to capture our patients.
Yeah. And
B2B, completely different.
well, and that's what I was gonna ask you about.
Yeah.
Did what you learned at HCA Healthcare
Yes.
and ho how you prepared that B2C journey, how did that shape how you approach that B2B environment?
Yeah. So I would say too, I learned a lot during our brand refresh because the most important thing in marketing to me as well, like when I go anywhere, is do your brand ambassadors, who are your employees, know who you are and what you do? So you need to start there first. Doing your homework. I mean, that's the same on both B2C and B2C side, or B2B and B2B, the B2C and the B2B side. Um, do your teammates, colleagues know who you stand for, what you do, what can you deliver on? Are they aware of the promise that, your company is delivering on? That's first and foremost in my mind. And so when I start anywhere, I make sure that our employees are aware of everything that's going on internally first before we promote externally. And so that's kind of what I'm doing right now. At Onsite Women's Health, when I came in, they have done a great job. They had rebranded from Onsite Mammography to Onsite Women's Health about 2 years before I came
Mm.
in. So, it takes time. And I do remember from HCA Healthcare, they would say during the brand refresh, it's like a dimmer switch, it's not overnight. And so that is something like, when I came in, do our teammates know what we even do? Do they know that we provide, you know, breast imaging services to primary care physicians and OBGYN offices? Do they know that we're partnering with Myriad Genetics, to potentially capture women who may be at a higher risk? Do they know that we're working with Volpara Health to make sure that our mammography technologists are positioning the right way during a mammogram screening? So first and foremost, it's education internally, and then you look at your audience. And then so for On-Site Women's Health in a B2B standpoint, my target audience is physicians, practice administrators, and again the PCP and OB-GYN offices, and that is a hard segment to reach. So it takes a village.
Yes.
But that has been something that, you know they have different personas than just a regular, consumer who I'm able to track, buying
Sure.
Slim Fast at a
Yeah.
store, doing other things from that
I bet.
standpoint.
Well, and so you spoke about your passion for storytelling, and that
Yes,
really how you took that and ran with it at HCA Healthcare in a
yes,
variety of vehicles.
yes.
Are you able to use those same tactics now to on-site women's health, even though you're not reaching out to the consumer directly? I feel like storytelling still has a place in
Oh,
that B2B marketing world.
100%. Storytelling is, I think, one of the most important things that we can do because we're the ones who are going to tell our story. Nobody else is going to tell it for us. And so I actually have used our social media channels. So, when I came on board, they hadn't been really utilized in about a few months. And so when I came, let me see, I actually wrote this down because I wanted to share it with you all. When I came on board, I've got it May 24th of 2023. On LinkedIn, we had 979 followers. Now, you talk about from coming from a company with over 500,000 followers to 979. I was like, wait, what? We only have 997 or 979 followers, which it did make sense though, because they had never really told their story
Sure.
and they were still growing,
Hmm.
at 14 years. Today, we are at 1,700.
Oh,
So
congratulations.
thank you. Which, at times it's hard to quantify. Okay, well, what does that mean, Julie? And so
Yeah.
in terms of going back and educating my leadership, I am now working on kind of like revamping our website, making sure that our message, that storytelling component is consistent across the board so that when we tell it internally, we're telling it externally too. So we're all on the same page. Yes. So,
Yeah.
with LinkedIn and Facebook and X, formerly known as
Yes.
Twitter, I have continued telling those stories. I'm doing career pathways to show from a recruitment standpoint. So we're growing exponentially. We're on a track to our goal is to acquire 30 practices this year. And
Nice.
so what we're doing is, we're going to have to staff those practices. And
Yeah.
so what we're doing is I've created a career pathways component to where we highlight a mammography tech who's now serving as a regional director or vice president within Onsite Women's Health. We're able to highlight, who is Onsite brand or who is Onsite Women's Health. Who are we?
Yeah.
So we created an animation to do that and showcase it and highlight it. So again, just educating our potential audiences both internally and externally.
I love hearing that, and there's a lot
Mhm.
to unpack there. One thing
Yeah.
that you mentioned is really pulling on the different levers, and so you can have that intentional growth to pull in more of these providers that you want to connect with and really support. But
Correct.
you also have to focus on the recruitment. What's that story you're telling? How are you telling that story, and how to get more people invested in the services you're providing? And I think that's great how the intentionality of what you're doing, in that it's about really pulling all of these services together and telling that unified story on both sides. And so you're getting away from random acts of marketing, just
Oh,
saying, okay,
absolutely.
we grew our LinkedIn, base, but what does that really mean? There's a reason you're driving that LinkedIn base and you're telling this story that's going to help here. So you're constantly trying to make sure that everything is seamless. Long gone are the days of just throwing out mailers and
Oh,
having
yeah.
commercials and everything. You have to have it all work together,
Yes.
especially on that B2B side, because the way people are receiving information, it's all unique and all different.
Mhm.
Now, I also know that there's a different connection, I would say connection points with business development in
Oh,
B2B
yes.
that's different than B2C. And so I want to get your, thoughts about or advice of how do you connect with the business development team? So make sure that you're working together. There's
Uh,
always this like I'd say weird, butting of heads when it comes to sales and marketing. But if these groups can come together, magic happens. And I'd love to hear your feedback there.
Honestly, I think that's a marketing best practice is collaborating with your service line teams, especially human resources and business development. That was one of the things when I came on board. I set up time with both of those VPs, respective VPs, and tried to listen on what are their pain points. What can I do to help them acquire those new practices or staff those staff our team. So with business development, let me go ahead and give you a few examples. So we are out there at trade shows and events, specifically where PCPs and like OBGYN providers, they're there. So I'm working with them on developing an ad like in that program or providing them collateral to speak with the physician on you know pop-up banners. They're like, when they originally came to me, they're like, here's our trade booth setup. I'm like, oh my word, oh goodness, I'm from the South. So I was like,
It
oh mercy. And so I was just like, okay, there's a lot of messaging here.
yeah.
We're not consistently telling the story. It did not look like who we were or who we wanted to portray to be. So
Mhm.
I worked with our BD team to kind of revamp their setup,
Yeah,
to make it and to ensure that it had our brand colors, our fonts, the clear, concise messaging that we wanted to convey. And it's not only what our BD team wanted to convey, it's also what leadership is saying. So when
sure.
I'm in this marketing role, you hear things from different sides. And so that's my job, is to bring it together and
Yeah,
tell that story. And then to make sure that everyone's on the page when we articulate it.
yeah.
Um,
It's interesting how marketing becomes the glue, and
oh,
you're piecing all
100%.
this together so you can have a
Yes.
unified attack. But at the same
Yes.
time, you're being very cautious of not hurting feelings along the way, and also encouraging like this appreciation of the hard work you've invested in this, and we'll take this, but this is where we need to go moving forward.
That's it. And then, you mentioned, you don't want to step on toes, or, I'm coming in, from this B2C side and trying to learn, kind of what's working, what has worked, what hasn't worked in terms of B2B marketing and sales, on the on-site women's health side. But I will tell you, it was different. So, especially because that's what we're talking about, is the transition. When I was with HCA Healthcare, you had different departments. So we actually had a whole digital team. We had a content team. We had a PR team. We had a marketing and brand team. So we always worked together. But here at Onsite, I'm all of those teams. And so, I'm trying to get, educated on the trends out there, what we can do. I will say, working with our BD team, they were utilizing Zoho initially, and we've now converted to HubSpot.
Okay.
So I am working with them in tandem, just to make sure, like, when we reach out to these primary, our target audiences, the messaging is clear and concise. And also with B2B, this is a long journey. It's
Yeah.
not just they're making those initial impulse decisions. Oh, which hospital am I going to?
Yes.
This is We are a service that is going to provide a healthier tomorrow for your patients. This
Yeah.
is a value proposition which will bring you profitability in the long run. So they're trying to make a decision. They've got a lot of people weighing in, how can we continue to kind of get our message in, into their minds, and so we are working with Hex IQ. I don't know if you're familiar with them, but
I'm
just
not.
kind of like, you know working with like a heat map, like if there's a
Okay.
specific territory or region that we're trying to target. I'm not there yet, as my initial goal is we're revamping our website, but I am so excited in the next year or two to do paid ads in these, heat maps, targeted audiences, and then kind of remind them. And then with search engine optimization, are they typing, what service line, is more profitable for my practice, or,
Yeah.
keywords. We've never utilized search engine optimization at Onsite Women's Health. That was
Yeah.
foreign to me. I'm like, what? We're not utilizing SEO. But so, there's a lot of opportunity as we continue to, I guess, educate
Sure.
audiences on our brand. The sky's the limit right now for us. I'm excited to see what that journey holds.
And I think it's gonna be interesting to see how you discuss the patient journey in the
Yes.
data that you get back and how you would receive, information based on that data. What's going to be
Yes.
the same thing here, which is on the SEO, the paid ads. You're going to get
Exactly.
information and you can use that information to better approach
That's it.
your target audience. Curious about this. So the you mentioned the B2B is a little longer term relationship. It's
Yes.
it's it's a longer, I say a longer strategy planning, and
Mhm.
it takes a little bit longer to really connect with your audience. What type of content ideas? I know you have a past, past in content creation. I'd
Yes.
love to hear kind of what your thoughts are moving forward of what type of what role does content play in the future of B2B marketing and some thoughts that you have regarding that in terms of connecting with your audience.
Absolutely. Content creation is huge. We actually already do utilize that for our practices. So, that long term journey that you're talking about, we provide our practices with marketing content each month.
Mm,
So, specifically, obviously, for breast imaging services, mammogram screenings, in terms of other content, blogs. We continue. So I produce a quarterly blog right now, and then we post that on our website just to get our name up there a little bit higher. And then we also let our practices utilize it so they become that thought leader in that space in their communities. From a thought leadership standpoint for onsite women's health, I am so proud to say that we could not have a stronger leader than Jillian Wright. I am one of her biggest fans. I have learned so much from her. She is um, just very purposeful in what she does every day, especially in terms of just making it a priority for our team to convenience drives compliance and compliance saves lives.
love that.
So that is something that we are really trying to get out there. Jillian was recently on a Becker's podcast speaking about this. So, that kind of elevated Jillian and indirectly on-site women's health as a thought leader in our space. She has done a number of interviews with local business journals and media outlets to where it's positioning on-site women's health as the leader in-office breast imaging services. So
Wow.
we are really starting to create that name, and that thought leader component just backs it up even more and elevates our brand. We have Dr. Susan Hawley, who's our clinical director. She is recently part of a team who has published a paper, and that will be in Radiology Alliance. And so that is something that we're going to give our practices so they can then communicate to their audiences as well. Case studies.
Yes.
Case studies, that's huge too in terms of content. So there's just, I mean, honestly, there's a myriad, a gamut of things that we utilize and when it comes to content creation.
Yeah, and that's I'm with you, like, that buyer's journey has changed so much,
Yes.
where it used to be a business development rep going out and speaking to people and explaining the changes. Now you have content that's readily available that's going to help guide these decisions and guide the audience. And of
Right.
course, that's been a big change, I'd say in the last 4 to 5 years of moving towards that direction. But do you see any other trends shaping the B2B healthcare environment moving forward? I know AI is always a hot topic. I didn't know if there's anything else that you've seen over the last year. And you're thinking, okay, this is kind of where it's going.
Yeah, I think I was thinking about that just before we got on this podcast. Personalization is, I think, going to be more and more important. I feel like everything is getting lost nowadays. And like when we kind of personalize it for that specific physician or that practice administrator and just say, like, we see you, and everyone's always, I always go back to that with them. What's in it for me? I think that's huge. And so if we can understand what would make their lives easier, what we can do from a service standpoint to help their patients be healthier, I think we're winning
Yeah.
from that standpoint. I will say we just tried a personalization tactic when it came to our BD team. We were reaching out to practice administrators, and it was a personalized name, like a whole, like we did our research ahead of time, and learned about the practice, and like we sent some mailers out, and we had great success with it. So I would say that would be an up and coming trend, would be that personalization. I also think with the increasing use of digital technology, we're going to continue to leverage those, especially there's a few of them out there. I know Unlock Health. You've got some things that I may need to utilize, down the road. So you and I've actually had that conversation of what digital components can maybe you and I partner on to reach our audiences better, because that is not going away. I don't think that's a trend that will go away.
It's just going to get faster and
It's going to get
faster.
faster and faster. And I would say too, the just data-driven marketing, the data analytics, just enabling us as marketers, to gain insights into our target audiences, like their preferences and their behavior, and then how to tailor our message from that content creation strategy that you and I were talking about. And then one other trend I would say would be value-based marketing. You know, we have to shift, like demonstrating the value that we bring from a B2B standpoint to their practice. How can we help them improve patient outcomes, and then reduce costs, but then also make them, profit for
Yes.
it. With on-site, there's no capital involved. We financially, you know, pay for the equipment and pay for or staff the mammotechs. We have 100% dedicated breast focused radiologists. So it's almost like, to me, when just almost coming in from an outside, I'm like, why wouldn't a practice do this?
Yeah.
It makes sense. It makes sense for the patient and for them. It's a win-win for both.
Yeah, it's just, having that message so they can see that,
So they
and
can
in
see it.
this world of so much information, so much messaging, it's really about how do you get this in front and then make it a priority,
It
and I think
is.
that's such a challenge now is getting in front of people. It's you mentioned the data and what you're excited about. It reminds me of the conversation I had with John Lynn recently, who I mentioned that I'd love to connect you both. He's the,
Yes.
founder of Sway Health. He mentioned the things he's excited about is the, personalization of the messaging,
That's it.
personalization of the vehicles, and then the
Yes.
personalization of the experience as a whole. And I feel like that is
Love
a
that.
trend moving forward is having
Yes.
this data and using it to provide a better patient experience overall. The patient now has more power than they've had before.
Ever.
So I think that's definitely a trend going in the right direction.
Absolutely. And even just with you and I mean, I'm sure you get multiple emails a day. I mean, we're all just slammed. And with that attention, in terms of marketing, you have to reach them what, 7 times, or,
Yeah.
but if they start to see their name, they're like, oh, someone talking to me, from that
Yeah.
personalization standpoint. And so, we're really trying to look at that down the road. And we're also doing that internally as well, trying to make things a little bit more personalized. I speak a lot about the internal marketing too, just because
Yeah.
I truly believe that for us to win as a company, it's for everyone to be on the same page and for our teammates or colleagues to know what we're doing.
Yes.
I mean, do they know that we have 120 plus practices across the nation? There's opportunities there. What are we doing? What is the secret sauce? I mean, why are we growing,
Yeah.
so fast? So it's just, I'm proud to be a part of that journey. And also, I'm proud to be the storyteller that gets to tell that great story.
That's incredible.
Yeah.
It's, providing a story that's making an impact on people's lives, and that's
Yes.
one thing I love about healthcare marketing is we're not selling widgets. We're
No.
making an impact in people's lives, and it's we do a lot of work in the senior living,
Mhm.
space, and
Yes.
something I always say is, like, people need to hear your story,
They
and the
do.
same thing with on-site women's health. People
Yes.
need to hear your story, and they need to know about these services. My
So
last
true.
question for today, and thank you for joining us.
Oh, you're welcome.
Here's my last question. What advice would you provide someone who's looking to potentially transition their career from a B2C standpoint to potentially a B2B standpoint where they feel like they can help even more people?
Take the risk.
Yeah, love that.
Um, Life is short. I think initially I was so comfortable at HCA Healthcare and I love the people I work with. But guess what? I love the people I work with at Onsite Women's Health. And you know
Yeah,
what? I'm learning more and I'm growing as an individual, both professionally and personally, to where I wouldn't have if I hadn't taken that leap. Continue to connect yourself with like minded people like Larry. You and I, we were connected via Carissa Bailey, a friend of
yeah.
mine who, she recommended you, which kudos to you. If you're recommended by Carissa, you're doing big things.
Seriously, she's a rock star.
She's a rock star. But you and I've connected, and since then, you've been able to speak with Jeff Whitehorn. And we just
Another great individual.
yes, he
Yes,
honestly, you probably should have him on here. He'd be amazing.
100%.
Yes.
Shout out to Jeff.
Shout out to Jeff, and then, but no, just continue to network, and you just never stop growing, never stop challenging yourself. And I'm a huge faith believer too. Like I feel like God will open those doors and you just have to be willing to take those, risk
Yeah.
and just pray about it. And I just think, the sky's the limit right now in terms of marketing. There's so much that we can do in this profession. But specifically to healthcare marketing, we're making a difference. Last year, we saved 1,268 lives from breast
Love that.
cancer. It's a pretty good feeling, to get behind.
That's
So,
incredible, and I love
yeah,
the fact that
take
you knew
take the
that
risk.
down to the exact number.
I
It wasn't
do.
around 2,000, it was a very specific number,
Yeah,
so
because you know what? Those last 8 women, their lives were saved too.
yes, yes,
So,
that's incredible. I want "Take the risk" to be on a T-shirt. We need to put this on a
oh,
hoodie or something. I
yeah.
love that, just to take
Yes,
the risk. A lot of
take the
times,
risk.
you're gonna be happy because you did take that
Yeah.
risk. Julie, where can people find you to further learn or to connect with you?
Find me on LinkedIn. That's a great platform. I mean, feel free to email me if you want to put my email out there. I'm happy to do that. Uh, LinkedIn's probably the
Okay.
best. Is
Yeah,
that what you would
we're
say?
both big believers of LinkedIn. Yes, I
Okay.
think LinkedIn
Yeah.
is a
Okay.
great platform, and it's a good
Okay.
way for you to continue to further this message and what
Yes.
Onsite Women's Health is doing, so
Yes.
we can all be more, aware and continue to
Yes.
spread that message. So,
Yes.
Julie, thank you again for joining us on the move, and look
Yeah.
forward to
Thank
staying in
you.
touch with you.
Awesome. Thank you, Larry.
All right, thanks.
Bye.
A big thanks to Julie for the engaging and inspiring conversation. Here's a quick recap of our conversation. Takeaway 1: storytelling is vital. Whether that is B2C or B2B, no one else is going to tell that story. We all know the need to tell it externally, but also need to be intentional in telling it within the organization. Takeaway 2: focus on value based marketing when it comes to B2B marketing. What is the value for your client? Position your client's success at the center of your marketing strategies. Takeaway 3: take the risk. Life is short. Never stop growing, never stop learning, and never stop believing in yourself. Thanks again to Julie Plummer for sharing her insights. And until next time, onward and upward.
Thank you for listening to The Move in Healthcare Growth. Add your voice to the conversation. Email the show at themove@unlockhealthnow.com. Follow us on social media and stay up to date at unlockhealthnow.com. Also, be sure to subscribe wherever you listen to podcasts so you never miss an episode.